everybody. Melissa Rhodes with Sagebrush Wellness and autoimmunerecovery.org. And I'm so excited that we are being joined today by Sydney and Christina. Um, we're really going to be talking about NutriPros. So you guys have been seeing all of the things that we've been putting out about NutriPros, and we're going to just dive deep today with you. And I'd like to welcome Christina as our presenter. Take it away, girl.
Awesome. Well, nice to meet everyone. We're so excited to be partnering with Melissa on this amazing new program called NutriPro. It's a personalized cellular nutrition program. It's fantastic. It's personalized to you, and we're going to get a little bit deeper into the program. So, let's talk about foundational nutrition. Foundational nutrition is what everyone needs for our bodies to operate properly, and do what it's supposed to. But unfortunately, we can't eat our way to perfect nutrition these days. Due to all of our farming practices, our soil isn't as rich as it was, 50, 60 years ago. An apple 50, 60 years ago was more nutrient dense than it is currently. And so, we can try as hard as we want, and obviously making good choices is what we want to do. But unfortunately, to get to that optimal nutrition, we can't eat our way there. So what we're going to talk about today is supplementation for that. And a lot of people are already used to that. Almost 90% of Americans are already taking a supplement or a multivitamin or something every day. And what I want to, this is our public service announcement for the day. Before you go out, buy supplements over the counter on Instagram, on TikTok, or wherever you're currently getting sold supplements from, I would highly, highly recommend that you first talk to someone like Melissa. She has access to very high quality supplements. We partnered with her clinic in making sure that, they all have COAs, which are certificates of analysis, to make sure that each of the supplements has exactly what it's supposed to and the potency in each of them. The unfortunate thing is, it's not supplements that you buy over the counter. By over the counter, I mean like going to Target, GNC, Vitamin Shop, wherever. They're not regulated. Yeah, exactly. Amazon. 100%. They're not regulated. And so what that means is that, they can put whatever they want in a bottle and slap a label on it and put it out there into the universe. In 2015, the Department of Justice in New York put a cease and desist order to Target, GNC, Walgreens, Walmart, because what they did was they took off the shelves certain supplements, just random ones. They just pulled bottles off, started testing them, and they had less than 4% of the active ingredient of what it was supposed to, what the label said. And so what that means is, you don't know what you're putting in your body. So what is the rest of that 96% in that capsule? You probably don't want to know. Some other reports said that they had fillers such as sawdust in there, So the point being, when you're looking for supplements, please make sure you're going to a trusted healthcare provider such as Melissa. Along the same line is they did this study showing that there are over 20,000 patients involved in this meta study, and they had people eating food and supplements. And these are like some of the more foundational things like vitamin D, vitamin E, magnesium. And as you can tell on this graph, even with fortified foods, supplements, all of that stuff, almost 40% of it, 70% were not meeting the minimum requirement for vitamin D. So again, when it comes to can you eat your way to perfect nutrition, unfortunately, in this day and age, we can't. But that's okay, because we have an amazing program called NutriPro. With NutriPro, what is it? It's a blood test. that looks at 50 of your genetic SNPs. So based off your genetics, how do you break down certain vitamins and minerals? But not only, so we know genetics is a roadmap, but we also take what's your current nutritional status. What is your intra and extracellular micronutrients? So what's inside the cell, what's outside the cell, which outside the cell is what's floating around in your blood. So we take, what you're genetically predispositioned and what your current nutritional status is, and a lifestyle questionnaire. So, what are your goals? In the lifestyle questionnaire, we say, do you want more energy? Do you need more sleep? How's your anxiety? All of these things. And we take all of this amazing information, we put it into a proprietary algorithm and customize super potent, fresh, very clean supplements, personalized just for you. And, why is this different, Christina? You know, why can't we just take a test and then figure it out? The thing of it is, we've had providers who have done something similar, but not to this level. It can take them anywhere from 8 to 48 hours just to calculate.
Yeah.
Okay, well, based off this genetic SNP and your, micronutrient values, like there's a lot of math involved. And, doing it individually for all of those things, taking into consideration like what your goals are too, it takes a lot of time. So think about that. 8 to 48 hours of Melissa's time times her hourly rate. That's gonna not be very attainable for a lot of people. So that's
Not to mention my brain would absolutely fry.
The meme where people are like, "Oh, what?" And yeah, it would take a lot of brain power and a lot of math to kind of figure out those formulations. And so that's why we do this proprietary thing, and we partner with healthcare providers like Melissa so she can offer you this program and these supplements at a more affordable cost. Um, so let's talk about optimization. When it comes to optimization, this is just an example of why NutriPro is super personalized and customizable to you. So, for instance, we will look at your genetic SNPs for how you metabolize vitamin A. Now, if you go to Amazon or your local Target, GNC, or any of those vitamin stores, and you get a multivitamin, the multivitamin will come in a beta carotene form. So that's just typically what it is because retinol is very expensive. Um, and so if you have the genetic predisposition to not break up beta carotene and convert it into retinol, you're never going to get the active form of vitamin A. So you can eat 2 bags of carrots every day. You can take all these supplements, but it's not going to convert because your body just doesn't, it can't do it. And so that's what the NutriPro test is going to tell you. Do you have this genetic mutation or not? And then in your custom formulation, we're going to give you that active form so your body doesn't have to break it down. We break it down for you. So that's just one little example of how it truly does optimize the supplements for you. And vitamin A is such an important fat soluble vitamin. Not only is it for our eyes, but it's for, our thyroid, our immune system. So multiple systems utilize vitamin A. And there's a lot of people out there that are just, taking these supplements and it's not in its active form. So you're basically just taking nothing. So we always like to test, not guess.
Yes.
That's fun. All right. And so now what we're going to do is we're going to go case study. This one is really cool. A lot of people could probably relate to it. This particular female, she's 50 years old. She's complaining of migraines, poor concentration, mood swings, poor sleep, all of these things. Just having a time, not living her best life. And so what we've done is she got her NutriPro got her blood drawn. And what I'm going to show you is after 3 months of supplementation, her before and after. So her before is this light blue color. And as you can see, pretty much all of her micronutrients were below average or deficient. And then the brighter blue, as you can see, she moved more to the average and optimal range. So optimal is that vibrant green color. But this is fantastic. After just 3 months, like the huge shifts from her being deficient to more in that optimal range are amazing. And the cool thing about this program is we don't just give you a supplement and then just say, hey, stay on it. As you can see, even for this particular patient, um, she still has some averages that can go to optimum. And so every 3 to 6 months after your first starter kit, we do retest just your micronutrients. We don't need to retest your genetics because they don't change. Um, and then we will continue to optimize until you are all in that green. But then we continue to monitor because we don't want you to go above because there is, a toxicity level as well. So we continue to monitor you through this journey. And, our lives never stay the same, right? So our supplements evolve just like your life does, like 6 months from now is going to be very different from, 18 months from now. But anyways, for this particular patient, as you can see, this is her before and after. But what's really cool is the additional benefits, not only in your micronutrients, but when you give your body what it needs, it does what it's supposed to. You know, um, your energy levels go up, your detox is increased because you have all the nutrients for your liver to properly do what it's supposed to do. Your immune system's working better. You're reducing inflammation and oxidative stress. So we did some additional markers on this particular patient, and her hormones leveled out. Homocysteine, as you can see before, her estradiol was super low. Homocysteine, which is an inflammatory marker, was very high. It normalized. HDL, which is your reverse cholesterol transport, it was super low. It normalized. Thyroid markers, HSCRP, another inflammatory marker. So as you can see, not only was she getting to approaching that optimal nutrition, but some of the other bodily systems were evening out as well. And these are the patient's reported benefits. So afterwards, she said that her sleep was better, lower instances of migraines, better concentration. All of those things that she had complained about 3 months before have significantly improved. So think about that. In 3 months, you've made these huge shifts. How is she going to feel, 3 years from now being on this program? So we're super excited to be able to, again, partner with Melissa in this amazing program and really truly changing these people's lives and optimizing their nutrition. So let's go down to the costs of the pills and the savings. So, like most of the formulations for each of the patients are going to be anywhere from 40 to 45. Who knows? Like just everyone's is going to be different because our genetics are different. Where we're starting micronutrient wise is going to be different as well. But what we did was we took just 15 of these ingredients for one particular formulation that we could find. And what we found was the patient was going to have to take 35 pills just off 1/3 of the ingredients. So if you kind of take an estimate, take that 35 times 3, this patient's going to be taking over 100 pills per day. I don't know about you, but I don't want to be taking pills all day. That's a lot. Well, I drink a lot.
Wow.
That's a lot. And so, and these are just, some of the things that you could, find off the internet. These aren't even some of like the truly therapeutic, more expensive brands. We picked ones that were in middle of the road. But as you can see, it's going to be over $1,500 for just these 15 ingredients. It's not
It's not even counting testing or anything.
nope.
Crazy.
It's taking it, right? So that's like the power of, you know, doing it so where it's personalized to you, you're getting exactly what you need. The starter pack, if you think about it, taking out the testing, right? Just the supplements, it's less than $16 a day. You know, we pay a lot for convenience, whether it be through Amazon or Uber or Postmates or DoorDash, right? Because time is very valuable. Well, you're saving a lot of time also because you're not guessing what to take. With this particular program, we're giving you exactly what your body needs. I like to compare it to like Instacart. Instacart, when you go grocery shopping, I know I'm guilty of this, is when I go up and down the aisles, I'm like, oh, I need this, I need this, I need this. And then all of a sudden you have a huge grocery cart full of food that you may or may not eat in the next week, right? So sometimes there's some waste involved, you know, but what I found is even though I pay for a subscription to Instacart, I waste less groceries. I get exactly what I need to make dinner for that week. You know, I'm not distracted because there's no aisles for me to go down um to like put into my cart. And so, you know, that's exactly what this NutriPro is. It's exactly what your body needs. You're not getting in that filler or that fluff. So, how does NutriPro work? So Melissa, you can either contact her office, ask about the NutriPro, or go onto her website on her WellPro store. You can purchase it there. So once you place the order, you will get a questionnaire, the lifestyle questionnaire. That is very important to fill out because we want to know your goals and what you're sensitive to and what current medications you're on, because that goes into the formulation. And then you will get a blood kit sent to you. You get your blood drawn. After we get your blood drawn and it's received at the lab, we create an interactive report, just like the pretty one that I showed you for our case study. And in the case study, um, it's a very easy to read interactive report. We're going to show you based off your genetics, like the transport, where there's problems in your genetics, in the nutrigenomics, but also, you know, it's very easy to see, okay, you're deficient or optimized. So once we get that interactive report, well, this is what I think is the most awesome is it triggers in our system. Okay, we got the interactive report. Melissa will look over everything, make sure it's all good. And then once we get that, we start formulating your supplement. Once we so they're super fresh. They're not sitting in a warehouse for 6 months, 3 months, 18 months. Who knows how long they're sitting in warehouses, especially with Amazon. You know, they're everywhere and you don't know how fresh those supplements are. And so the nice thing about what you're receiving is you're getting it like 10 days after, right? So as soon as they're formulated and they get shipped to you, they're the freshest possible they can be. And then you're taking, you know, just whatever the amount of pills that it suggests for you and just one packet per day. So you get all your nutritional needs. You're not like, especially if you travel, I travel a lot to go see my reps. It's super nice to just take one bottle and, you know, how many ever days I'm gone and travel with that. In the past, I was like a walking pharmacy. I felt like I had 19 bottles in each of my carry-on. And it was like
Yes. Yes.
and you're like, oh, don't judge me, TSA people, because I have like all these supplements in my bag. But now it's super easy. Just one bottle, one sachet every day, and I get exactly what I need. But again, it's a lifestyle program. We continuously reformulate to optimize to you. It's a program that is constantly evolving, just like you are. And it's an investment in yourself. So, um, like I said, you know, what is it worth to have more energy, to, you know, not have as many migraines? I know a lot of people experience hair growth. My hairline changed since being on this. I know.
Mine as well.
Yes, it's been awesome. And like the energy. I actually sleep less because it's more rested sleep and I get more things done. So you take into consideration what is important to you. And like I said, for less than $16 a day, I think it's worth it to invest in yourself. So do you have anything else to add, Melissa?
I loved one of your case studies when we were looking at the optimized. Go back one more. Whoops. There we go. Right there. So look at this vitamin A, WBC. That's white blood cell. It's basically your immune system in action. Vitamin B3, WBC, white blood cell. So what I want to kind of bring to the forefront is we work with a lot of people with autoimmune conditions, right? And part of really helping the immune system come back to regulated and normal, just riding the middle of the road like it's supposed to be calm and not just either depressed or just going crazy all the time or flip flopping between the two. These are some of the things that can really, really support that journey. Um, like the RBC, that's red blood cell. That's looking at the inside of the red blood cells. You have to request special labs at the doctor's office to even get a look inside your red blood cells. So this is, to me, it's huge, especially for my clients that are struggling with autoimmune conditions and they're working on really recalibrating their body and becoming well, sustainably well. This can be a huge tool, and you can see the numbers on your screen.
Yeah, absolutely. And just to drive home your point too, if you're going to like your normal conventional doctor, they're not looking at your RBC. You're 100% right, Melissa. They're not looking at your white blood cell. When I was talking about earlier, there's some value in looking at what's in your serum, which
Mhm.
is typically what the doctors do, but that's what's floating around in your bloodstream. What
Mhm.
was really important is it actually functioning? Are you utilizing it how you're
Yeah,
supposed to? And the only way to be able to check that is to look inside your white blood cell and your
exactly. Exactly.
and just to let you know, we have the testing for this is the most advanced when it comes to micronutrient testing. It's a direct measure. So we basically like break open the cell and see, oh, is there vitamin A in your white blood cells? Other companies, they do calculations, things like that, but we actually look directly inside your cell to see, if there's a deficiency. So,
Yeah.
but you're right, Melissa, 100%. If you're going to your normal doctor, they're just scratching a tiny bit of the surface,
Yeah.
not getting down to that root cause.
Yeah. Yeah. I love
Uh,
that.
awesome. Yeah. And so if you guys have any other questions, again, we're shifting your nutritional status, but also look at some of the other additional benefits
Mm.
and mark
Mhm.
that move when you give your body what it needs.
Yeah.
So we're going to do a couple more series on this. If you have any questions, please reach out to Melissa and her team and they can answer that. But we're excited to be partnering with Melissa on this amazing new program. So thank you guys so much.
Oh, thank you so much. I appreciate this conversation because I feel like it is filling in some of the gaps for our clients that are really looking at this and going, I want to do this, but I don't understand it. So thank you for sharing this presentation with us. I appreciate it.
Of course, no problem.